Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, policy, and practice. Each month, we select an article to feature as a press release with an accompanying podcast. Today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm speaking with Dr. Erin McCrossan, who is the corresponding author for the article titled "A Growing Relationship: Cultivating Organizational Readiness to Influence Implementation of Policy, Systems, and Environmental Change Programming in SNAP-Ed-Funded School Community Partnerships." I'm glad to have you with us today, Erin.
Thanks so much for having me.
Sure. And can you tell us a little bit about yourself?
Sure. So I am a former high school English teacher, actually. And then I went on to get my PhD in urban education from Temple University. So I'm not a public health person. I'm not coming from a public health background. I'm actually, kind of a teacher. And in my dissertation, I did a qualitative study of different types of school lunch programs in high poverty schools. And I really found that food insecurity and hunger really permeated students' experiences and affected school climate and students' ability to engage in their classes. That's how I ended up in this type of work. Now I'm a senior research associate at the School District of Philadelphia in our Office of Research and Evaluation, and I serve as the primary evaluator for SNAP-Ed and CDC-funded programs. And I also help coordinate the Philadelphia Youth Risk Behavior or the Survey, or the YRBS. So much of my work is funded by SNAP-Ed, especially looking at how school community partnerships can address food insecurity. I also work closely with our school meals programs to increase breakfast participation in particular, and I've also conducted evaluations of backpack programs and produce stands. And additionally, I'm often tapped to conduct focus groups on a number of other equity and school climate related topics for the school district. But again, I really come to this work with an education focused lens.
Great. Thanks so much. And you've got quite a programming background. So that's exciting. So can you tell us a little bit about your paper, including what you did and some of your key results?
Sure. So first, just a little context in case people don't know. Philadelphia has the highest poverty rate of all major U.S. cities. And we know from our own data that my team actually collects using the USDA food security screener that our school district families experience food insecurity at double and triple the state and national averages. Some schools facing 30, 40, or even 50% of their student populations, which means 1 in every 2 students potentially is sitting in class hungry every day. So I think food insecurity is a huge driver of the achievement gap in education. And my hope with this work is that decision makers in both in education and in public health can work better together to address it. So we have 7 SNAP-Ed funded community partners working in our 200 plus schools. Our Philly SNAP-Ed program is a wonderful program that can really make a huge difference. The only negative comment we really ever hear about it is that schools want the program to come more often. And I also think that our setup is unique in that we have staff that are internal to the district that are funded by SNAP-Ed, which gives that office a unique ability to be the backbone organization that is able to coordinate the many different community partners that do this work. And our research office is also internal to the district. So we are uniquely situated in terms of access to data and networking to conduct research like this. So the study itself, as the focus of SNAP-Ed nationally has shifted from direct nutrition lessons to policy, systems, and environmental work, or PSE, evaluating these efforts has become very challenging. Our SNAP-Ed implementers really want to know how to better align their programming for collective impact, and collecting data consistently across programs is essential to understand what approaches work and what don't. And since PSE evaluation is kind of a relatively new frontier and SNAP-Ed at the state and national level, so kind of figuring out how to best measure it, we've decided to take a qualitative approach. So this article is based on a case study, a larger case study of 19 schools, including our 7 SNAP-Ed funded partners, with 119 interviews of school staff and nutrition educators and directors, and 138 hours of observations. And so our study resulted in a very long report to our funder, the Pennsylvania SNAP-Ed management entity, with sections on findings kind of roughly organized by early, mid, and late stages of implementation. And this paper is the first on readiness, and it looks at how SNAP-Ed implementers decide what programming and what amount of programming, what type of programming should be offered at each of their sites.
That's awesome. Thanks so much for that overview, Erin. And I'm really glad to be focusing today on the importance of policy, systems, environmental change programming. So much of what we do as nutrition educators hinges on the readiness of an organization to implement programming. So with that being said, what is readiness, and what did you learn about how it's applied in practice?
Yeah, so readiness in the theory of organizational readiness, there are three kind of factors. There's motivation, there's innovation-specific capacity, as well as kind of general organizational capacity. And what we found was when SNAP-Ed implementers were thinking about whether a site was ready or not for programming, they primarily based their decisions on the general organizational capacity. So things like school climate, student behavior, whether their contact, the person that they reached out to, was communicating with them. And they didn't focus nearly as much on the organizational factors that are actually more in their control, such as increasing staff motivation or buy-in, and innovation-specific capacity, such as like offering direct services, training, and supports for specifically nutrition. So they kind of, in our study, we found that they tended to think about readiness as a static or binary characteristic that a school either did or did not have, and not really about the ways in which they themselves as implementers could help a site increase their readiness over time and grow the relationship, as well as their own role and responsibility to do that. And our research is really consistent, I think, overall with the prior studies that have shown that the key to implementing PSE initiatives successfully is really building those long-term trusting relationships, and that really takes time. And so what we saw in the schools that had much higher levels of PSE programming that was successful was that the SNAP-Ed staff person that had really been working in those schools for many years was considered part of the team and really integrated, and everyone in the school knew them.
So, so specific to SNAP-Ed implementers, what are the implications for the schools when viewing readiness in this way?
So what we saw was that some of our highest need schools, the type of schools that would not kind of pass the readiness quiz anytime soon, because they're perpetually short-staffed, under-resourced, and just really overwhelmed with the needs of their students. Those types of schools, under this kind of view of readiness, would just never receive the programming that may actually greatly benefit their schools, that their students really, really need, such as access to fresh produce, cooking lessons, recess equipment, movement break programming, and those types of supports. And I think that SNAP-Ed implementers just really need to appreciate how stretched thin some of our teachers and school staff are. And just because they don't return an email or a phone call on the first try, or just because they're dealing with challenging student behavior, doesn't mean necessarily that they don't want or need SNAP-Ed programming, or at least some kinds of SNAP-Ed programming. And I can tell you from personal experience as a teacher in a high poverty school, there were so many days when I felt like there was just not one more thing I could add to my plate, even if I wanted to, and I could definitely see the need for my students. So we think that SNAP-Ed folks need to be really persistent and offer tangible resources up front when they're first initiating contact with a school, that they know that families need, and really provide the staffing to run those programs, like produce stands, backpack programs, recess equipment, the tangible things. Those are great ways to get in the door and begin to form those deep, trusting relationships over time that will later facilitate more types of PSE. And I think that SNAP-Ed implementers really need to show schools, just by showing up over and over again, that they are people who the school can count on, that they will take something off of their plate and not add or expect more from school staff to run additional programs or teach additional lessons. And then I wanted to say a little bit about the implications for how SNAP-Ed collects programming data in general. And we didn't highlight this as much in our article, but I think it's worthwhile mentioning here. I mean, I think it's a common tension. It's not specific to SNAP-Ed, but it's a common tension within organizations, kind of the tension between breadth versus depth. So there's a lot of emphasis on reach numbers, making sure that we're reaching as many people as possible. But at the same time, the fundamental challenge is that high reach numbers are sometimes incompatible with cultivating those deep relationships, which is really what our study is showing is the key to equitably implementing PSE programming in a high needs site. So high reach numbers and equity may actually be competing objectives. And we would love to see our SNAP-Ed programs have more like permission, quote unquote, to choose fewer sites to fewer sites, but high need sites that they can go deeper in, so they can get kind of credit for the hard work of the relationship building that I'm not sure that they always feel like they get credit for, because something hasn't quite happened yet, but they're just building those relationships. How do we count that? How do we incentivize that? And so the pressure to attain certain reach numbers might actually unintentionally incentivize only working with schools that are quote unquote already ready, and not allowing the time and capacity to go truly deep and advance equity objectives. And so we're really encouraging SNAP-Ed policymakers and implementers to deeply consider those tensions that we've illustrated in our study, and maybe even rethink some of the ways that they report and prioritize certain types of data like reach.
Great. And I think this work is such an important piece in the puzzle for understanding and improving the factors that promote nutrition-related behavior change, oftentimes some things that we don't necessarily think about. So I really appreciate this work, and want to thank you very much, Erin, for spending this time with me today.
Well, thank you so much. It's such a pleasure to be here, and we're so grateful for your support. I also wanted to thank all of our collaborators and our participants, especially my main co-author, Liz Fornero, my colleague at the school district, as well as my other co-authors, and Lauren Nacito, who is our Philly SNAP-Ed director, as well as all of our partners, and our funder, the Pennsylvania SNAP-Ed management entity. They couldn't have been more supportive. So we're just really grateful for all of that.
We've got quite a team there.
Yeah.
And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months. Thanks again, Erin.
Thanks so much.